I'm Dr. Sanjay Kamble, and on behalf of Wockhardt Medical Team, Wockhardt Medical Connect, and that RSSDI TV brought to you by Wockhardt, I welcome you all. So today we have with us a renowned diabetologist from Ranchi, Dr. Vinay Dhandania sir, and sir delivered an excellent talk yesterday on telemedicine. So looking at the current situation of the pandemic in the country, the topic is very apt. And so I would like to ask sir, what key messages would you like to give our viewers who now wants to take up this way of seeing the patients when it comes to the protecting themselves from the current situation as well as in the best interest of the patient? So what would be your key take-home messages for audiences?
Thank you for this question. It's a very, very relevant question today in the era of digitalization, where you get food from Zomato and Swiggy and deliver all your utilities from Amazon. Now even you have doctor's consultation sitting at home, which is very, very crucial for people who have not been able to follow up to your clinic or reach to your clinic because of lockdown during COVID times, or because of difficulties in access to your clinic. And if you see the theme of World Diabetes Day this time, that is access to diabetes care to all, I'm sure this teleconsultation is going to be the modality where we can give or provide specialized diabetes care to most of our diabetic patients all over the country. And that is the best part of teleconsultation. The most important thing in teleconsultation is you need to draw a line which patient can be given teleconsultation, which patient cannot be. That is very, very important. Don't forget that you have to decide patients who are on follow-up that can be easily advised for adjustment of insulin doses, patient with pregnancy who needs adjustment of insulin and medicine during their pregnancy state, patients who have been discharged from the hospital and they need follow-up advice, they can be done on e-consultation. But patients who are critical, who sound critical on teleconsultation should be advised for personalized consultation in the clinic by appointment or visit a hospital. For example, patient can tell you, I am having chest pain. So you should not do something like try this tablet and try this medicine and wait for a couple of hours and get back to me. You should immediately ask them to visit a nearby hospital and get themselves checked, because the therapeutic window is very, very narrow for such patients. And if they don't visit the hospital within a certain time, there can be catastrophe or seriousness of that particular patient. So it is very important in teleconsultation to actually pick up the correct patient for consultation. At the same time, data keeping is also very important. For example, if you have advised someone on teleconsultation, you need to keep their records for at least 3 years in your clinic or within your device. Why? Because you are under legal consideration for whatever advice you have given to such patients. So two things are very, very important. And after the guidelines which was published by the Indian Medical Council in 2020, I'm sure we all have done a lot of teleconsultation. And COVID patients, you will not let your COVID patients to visit your clinic, isn't it? Because they are going to be infectious and they will transmit the disease in your clinic. And when consulting a COVID patient on teleconsultation, just try to exclude three things: mild, moderate, and severe nature of disease. If you can see the patient is mild, he just needs home quarantine and consultation, you can very well easily advise them and ask them to be on regular follow-up and monitoring. But if you see the patient is having hypoxia and oxygen saturation drops to less than 80, you need not advise anything except visit to the hospital immediately. So this is how teleconsultation has helped patient in this COVID time. And definitely the care and the follow-up of diabetes patient has improved. We thought one time that patient may not be able to visit your clinic during this lockdown, but this has not happened because of the teleconsultation. And I request most of my friends and colleagues all over the country to start learning this process of teleconsultation. It's just a couple of days of practice which is needed, a couple of days of learning which is needed, and you can very well enjoy this nature of practice. So with this, I thank the organizers and I thank the Wockhardt team for this particular initiative for spreading the knowledge of telemedicine. Thank you.
Thank you, Dr. Dhandania sir, for your views. Definitely, the physicians need to learn. Many of them have already been doing it, but definitely your key advices to them would help a lot way ahead in doing good teleconsultation. Thanks a lot, sir. Thanks for coming.
Thank you.